All right, let's call this meeting to order for the Board of Health for the City of Lubbock. I'm pleased to see a good turnout. I always appreciate the participation of citizens that are here. I think that's really excellent that we're able to come in. We have two citizen comment to sign up. And let's see, first we have Carlos Ortiz from Star Care Voices. Carlos? Sir, please go up front and speak to us from the podium.
Well, I need to time it.
We'll give you 3 minutes. Okay.
Yes, my name is Carlos Ortiz. I work with Star Care. Back in October, we took over a coalition called Voices, and we go out and talk to youth about drugs, kind of prevent them from getting on. I know a lot of times they kind of look at the after effect. If we can prevent the kids from getting on drugs, whether it's marijuana, synthetics, or prescription drugs, we've accomplished something. Because, like I like to tell people, it's not about us sitting here as a grown up, it's about the youth. We can prevent it, it'll go back to law enforcement and other agencies. Like, talk to the mayor, law enforcement, everybody behind it, some of the hospitals. I wanted to talk to y'all, maybe we get y'all to help us. I know y'all working on synthetics. And if we can work together as a team, it will actually help the youth in the long run. Instead of everybody trying to do their own individual thing.
Are you going to tilt that down? Now, because this is on the agenda,
It's not on the agenda.
well, the synthetic drugs is,
Okay.
so that we could interact if we had questions? Okay. Can you give us an overview? I mean, I know we all have the brochure here. Is there anything in particular that you'd point to as services that you provide, or where you feel like you've had some success?
We've accomplished it. We go to a lot of these schools, we're doing presentations. We've got some of the children actually tell us what is out there, what they're facing, the kind of drugs, like prescription drugs, or where's the kid, he's already got in trouble. Brought it up in his house, he can just go get it and go sell it. I mean, that's something like synthetics. He said he can go down to a smoke shop, he pick it up and go do it and sell it for a little more. He said a lot of people don't address that. They're looking at the marijuana, cocaine, the real drugs. So I mean, like I tell them, it's not about law enforcement enforcing laws. It's about us as grown-ups helping get it off that shelf.
Is this a local group or?
Yes, sir. We're local. We're here in Lubbock. We start in Lubbock County, and I find that you get all the cities in Lubbock County, all law enforcement is involved in it. Like I told you, if we do it all as a group, our chances of reducing the rates from going up is going to be real good. And I know in the past I've studied it. Everybody got small groups that do it, and they all do individual plans. Like on March 11th, I'm holding a forum with our elected officials, law enforcement in the hospital, to find out ways we can work together. And if you do it separately, everybody has one outcome. We need one big outcome for the whole community.
Go ahead.
What do you see as, how are you going to go about this besides assembling a coalition? What kinds of programs?
Okay, when I'm looking at it, I've been doing this about 4 months. I came over from law enforcement myself. I think that we need to address the issue of the drugs we talk about, but we need to look at the parents inside of it. A lot of times these parents are just kids themselves. They think nothing about it. So as we go out and we talk to parents too, you got to tell them what they're looking at, what kind of symptoms these kids are having, so they can get some treatment. Because I've seen them come through the emergency rooms and come here, the parents have no clue what they're on. So as a community, we need to educate the parents.
It might be in the brochure, but where's the funding from?
We get the Department of State and Human Services. They give us, they're the ones that are funding us right now.
Okay. Would you say that synthetic drugs, since that's a topic we're going to be talking about today, any comments about awareness that the public has about this, or is this still something that most people aren't, it's not on their radar?
No, I mean, a lot of the children I talk to are aware about the synthetics. They know how easy it is to get. But the problem I see is, like I said, a lot of the parents, like, I mean, you bring up alcohol or marijuana, they know what to look for the kid when he comes home. You talk about these synthetics, they got a different reaction than in talking to the researchers. These drug tests on some of these synthetics, they're going to come back negative. So now, how are you going to treat him? He's not popping. They're coming up with new drug panels to catch these synthetics. Which, I mean, people talk about law enforcement or changing the laws on it, that's not going to catch you. But they're geared for one thing. Can we get them things off the shelf? We're going to face the synthetics. Well, what they do, you outlaw, just say spice. they go in and change the compounds and put it back on the shelf. It's legal again. So we need to do is grown-ups just get it off the shelf. Kind of like we've seen tobacco use drop over the last 10 years. We need the same thing with synthetics. Get together and get them off the shelves.
Okay. Anything else from the board? All right, Mr. Ortiz, thank you very much. We have Teresa Alvarado, also from Star Care Lubbock Voices.
Hello, everybody. Thank you for allowing us time to come and speak to you all. I am the actual Coalition Community Program Director for the Lubbock Voices Coalition. A little history about the Coalition. It's been around since 2001. We recently were under Managed Care Center for Addictive and Other Disorders. We went through a fiscal agent change in September, and so now we are under the fiscal agent of Star Care Specialty Health Systems that used to be Lubbock and Mexamar. As everybody knows who they are. What we do as far as with the coalition, to answer some of the questions that were asked, we change policies, laws, procedures, attitudes, and behaviors towards drugs in the community. And what we do and how we do that is that we get partners from the community to be part of our coalition, and we work toward doing a community needs assessment. Once that needs assessment is done, we use that to make a strategic plan so that we can identify the strategies that we want to implement into the community so that we can help keep the kids off of drugs and alcohol. In order for us to do that, we need the help of our community members, and we now have the mayor on board. As of yesterday, we talked to him, and he's all for what we're trying to get accomplished. We also have Lubbock PD that's also on board with us. And so we ask that if you have the youth health issue up front and center in your community, then we can work together to make Lubbock a drug-free community. And that's all I'm asking is if you're interested in being part of that, you can get with Carlos and I, and we would love to come and have a one-on-one meeting with you and give you more insight as to how you can become a member and how you can become involved in helping us. We have several different strategies that we're working on, and we need community help with that, okay? And so your voice can be heard, and it can be heard through Lubbock Voices Community Coalition. Thank you.
Any questions?
Mr. Chairman, I think we need to appreciate what this coalition is doing. That's admirable work. My question to you is, important part of this is education, public education.
We do presentations. We go out to any group that wants to hear us. We go out, we do presentations. We can do presentations on synthetic marijuana, prescription drugs, alcohol, underage drinking, alcohol use, and that's what we do. We also use some of our coalition members to go out and help us do these presentations. So we train our coalition members on the effects of every drug that we're working towards. They go out, they do presentations. Carlos and I also go out and do the presentations because, you know, at times our coalition members work for different agencies in the community, so they're not able to go out and do the presentations for us. So we as staff fill in and we go out and we do them. We try to get into every school possible because that's how we reach our youth. Sometimes it's kind of a feat to get into the schools, them not knowing who we are and just not being aware that we're out here.
That's my next question. Thanks for that. How do you want the LISD to give this part of education to the students? How is that working out?
The strategy we've been using to get into LISD is Carlos has contacted the health teachers, and they have allowed us to come into their class time and talk about different drugs. Because as far as contacting LISD directly, we weren't able to get in. So being able to get through with the teachers, we've been able to do that. We're in the JJAT. We have presentations set up until May. We are at Premier High School. We've done presentations at Premier High School. So a lot of the alternative schools have opened the doors very easily for us to get in and do our presentations.
Thank you.
Any other questions? Thank you very much. We appreciate your coming and letting us know about your programs and services.
Thank you.
Just one other comment under citizens' comments. I had hoped to have a special guest here today to talk about the direct impact of synthetic drugs. Unfortunately, I spoke to her this morning. She's at the emergency room with her husband, who has his own set of issues, but she does want to still take a public stance, and she'll be joining us next month to talk about what is a very personal experience that she's had with the damages that's happened in her own family. Moving on then, let me get that back over to you. We have a work session here, some discussion about the synthetic drug ban. I thought it was important that we keep our finger on this, that I appreciate the gallery that we have here today from the public, and I assume that many of y'all are here to either cover this or to just stay informed with it. Part of the difficulty is that I did an interview with the Daily Toreador reporter back in December talking about the difficulty that law enforcement's having with the ban. That it's as Dr. Reed had talked about before, part of the trouble is that if we approach it from the position of trying to ban substances, well, they keep changing the substances, or we can't test for the substances, and so it's really been difficult for law enforcement to do much. And in fact, in this report, the reporter found that many of that there was still the presence of these K2 spice, synthetic marijuana, bath salts were still readily available in some of the stores in the community. So two things I want to advise you of, which I'll bring a more formal report for the next meeting, is that because I do think education is the best outreach, that I've gotten some yet to be revealed sponsors that we're going to do a competition, a video competition. That the great thing about our youth today is I'm constantly amazed when I look on Facebook or I look on YouTube and I see these great videos that are produced by little 14-year-old Steven Spielbergs. And so we're going to have a funded contest where I'm going to ask that the young people of Lubbock submit a 10-minute video about their own sense of the menace that these synthetic drugs represent in our community, and that we'll have a cash prize for several of the first divisions, and then we can feature those in public service announcements and elsewhere in the community. And I think that we need to bring the young people in on this because they're good at this. And so I'm hoping that as I put this together more formally, that we can do this through the spring, get some good competition, get some young people submitting videos, and maybe we can have an effect not only for locally but also for across the country, that we can take these videos and put them out there. So I will give you more specifics, but just keep in mind, so we'll do a video competition for letting young people submit videos as to what are the problems that we have at this level. The second thing is, because we're not going to be able to get this, there's only so much we can do legally, I do think that as a community, we have a right as citizens to know who these people are and what they're doing. And so one thing I did is if you just go in the yellow pages, that you can find readily listings of various shops under cigar, cigarette, and tobacco. But because some of them may not be involved in the selling of these heinous products, that we're going to be going out in the next 30 days and we're going to find out who's selling this, and then working with a community group, not officially through the city or not through the Department of the Board of Public Health, we're going to begin to track who are these people and where are their shops. And if you know some of these people and you happen to sit next to them in Sunday school and you'd like to tell them that you don't appreciate what they're doing for this city, if you know, if you see shops, cars parked out front of people you go tell them that you hope that you're not supporting these people. That I understand that that they're all legal, but I think it's atrocious that we have it, and so I think that we have the right as citizens for a boycott of sorts. But again, I want to make sure that I have the latest information, but I think that we all recognize that I would hope Lubbock is still the biggest little city you'll ever live in, that it'll have some impact, that we can come back and just say, we don't like that you sell these things, and then hopefully get people to reconsider that even though it may be profitable, maybe it's not the right thing for them to do as good citizens. So both of those I'll be reporting back. In fact, even this morning I got an email from a instructor over at the Byron Martin Center, and she asked that would it be possible for my students, she wishes that she could have brought them here today, but that they'd like to create a map of some of these shop locations with the list of addresses, and that they can then map the targeted demographics of these places. And so apparently there's a real interest among the high school kids to deal with this problem, because again, it's as anybody, like even today, I suspect by this morning already we've had probably 1 to 2 ER presentations in this city for synthetic drugs, because the reports we're getting back from the ER physicians is that they have 2 to 4 a day. Okay, and so already we've had 2, I suspect, and this coming up on a weekend, we're probably gonna have a few more. And even though they're cheap products to buy, you look at the costs of emergency medicine and you don't know what you're dealing with, and then the talking to people, Bob Howell and those guys out at Dovetree, it lingers for weeks and you get brain damage and things from it. And I think that we're going to stay on top of this issue, and I think I speak for the board of saying that we believe that this is something that we may not be able to, we're going to certainly support our law enforcement as much as we can, but we're going to have to come at this from a legal perspective, or from a social perspective and an educational perspective. And I think that we can get a lot done. We just need to kind of keep it in front of us. Any comments or anything about those ideas? Any thoughts?
Well, we're going to hear about the chemical.
Yeah, and then I would like to introduce here at the end of this table here, David Klein, who is, I'm most pleased that he's here to join us. He's a new faculty member here at Texas Tech University. I'm reading from a note that Dr. Reed had given me. Said that he is good at detecting trace amounts of different compounds, and that you've done some work on synthetic marijuana. And so I'm most pleased that you could be here today and give us a little bit more of an overview of what you do and your thoughts on this issue. David Klein.
Thank you, Dr. Carr. I guess we have to use the microphone. I'll try not to hurt y'all and stay a little back from this thing. I'm relatively loud. I have to teach and talk to the students all the time, so I don't really use a microphone. It's sort of painful, but we'll go with this. My background is in chemistry, and I came here in September 2012. I'm out at the Institute for Environmental and Human Health along with Dr. Presley. My job out there is to be the chemist. So I have 14 other faculty members, and I support them with chemistry, and I support people around the university, including doing some collaboration with Dr. Reed. So I have a broad base and a broad knowledge of chemical things, and when I saw your interview, Dr. Carr, with the El Toreador, about some of these questions, and people said, oh, well, it's very difficult to determine what these compounds are. Well, I gave you a handout. I don't want to have to read it, but everyone has one of these. There's some references on the bottom. Clearly, one can see about 30 of these, over 25 of these compounds commonly used. There may be some others that are quickly developed, and there are methods in order to find those as well. As in everything, I live in a world where there's a cost associated with just getting students involved, getting standards to run the instrumentation. I held a seminar back in April last year, so almost a year ago, and I brought Dr. Jeffrey Moran from the Arkansas Department of Health, who was one of the first people to develop methodologies to test for these synthetic cannabinoids. I would note that along with other things that have been said today, when people talk about bath salts, those are more along the lines of synthetic amphetamines. So there are two very big classes of compounds. We can certainly work towards testing those. And we can work with folks within the health area as well. The last reference that I gave you on this handout, there's a method that's been published of looking at about 30 of these compounds in human blood serum. So there are ways to test this if that's something we need to bring forward as a community. I stand here as a new guy at Texas Tech and part of TIE to help try to bring answers to this that we can look at, because we all know that there are some really bad effects that come toxicologically from looking at these synthetic cannabinoids. Before I came up here, I was in Austin at the Texas Department of State Health Services, where I ran the Chemical Terrorism Response Laboratory. Part of that was looking at unknown threat powders. So I went to the toxicology meeting where I heard the woman from, she's been all over the national news, I'm sorry, I don't remember her name right now, but she was running the emergency room in Dallas and had talked about for years never having had the types of drug psychoses that are showing up in the emergency room that are now common daily from these synthetic compounds. And I think, in closing, I would say that I agree with some of the statements made over lunch by Dr. Presley. I think it's a real problem to talk about this as synthetic marijuana. I think it trivializes what we're looking at. These are synthetic compounds that were experimentally designed in order to test certain features. They have nothing to do with marijuana, only that they have a base compound backbone. But they were all synthetically derived and pulled out of that literature, and now they're being modified in order to walk around what were the old synthetic design or drug laws. So we have technology to do this, And if there's any questions that y'all can ask me, I'd be more than happy to try to answer them.
Dr. Reed?
So could you put together a list of all the compounds that you can analyze for that they are currently using?
Yes.
All the ones that they may try to get, all the ones that you would have to develop new techniques to analyze for, and all the ones you might have trouble finding, and then come back with a cost to develop this for us?
Sure.
Because I think we really need to get the list, get the costs, and then I think we should try to make a recommendation to the city council about trying to fund this, because I think it's going to save the city or the county a lot of money if they can do such a thing. And then we talk to the lawyers. Do we have anyone here from the legal?
No, they're not.
No one here today. Talk to the legal department about how to go about this.
Okay. Dr.
Kind of
Presley?
along those lines, you can pick it up in blood. Can you pick it up in saliva? Since it's in serum, can you pick it up?
Right. People, there is a patent. I was doing my due diligence as I've looked into this the past few days. There is a patent application out right now to look at a saliva test, which is an ELISA test. To be clear, ELISA testing is where one uses antibody testing, and there are certainly false positive and false negatives that happen in those tests. As a chemist, I do mass spectrometry. We look at things that are not only screened but confirmed within a very expensive instrumentation, $100,000 up platforms. So we look at the mass spectrum of these compounds. So we don't have so many problems. But there are tests that are currently, people are moving very rapidly to develop ELISA testing, so that saliva tests, roadside tests for driving impairment are being developed. I can't tell you exactly where that stands right now.
And that's what I'm headed for. The less invasive, the more easily incorporated.
Mm-hmm.
Right. There are a lot of urine tests. Obviously you have to get a urine test, and that's a little bit easier than getting a blood test in any of this. And the one thing I would say, Dr. Reed, in this question is that we still have to deal with who's going to use our information. If it's law enforcement, then it has to pass legally defendable criteria. If it's on the health side, if we're looking for hospitals, then it has to pass CLIA, Clinical Laboratory Improvement Act criteria. And those are relatively high levels of burden, but we can develop tests and move into those areas. The last lab I was in was CAP approved, the College of American Pathologists, so I've done CLIA regulated work before.
Yeah, well, when we met with the city attorney's office before about this issue, the biggest problem they had was, of course, the fact that they got a sample, they have to send it all the way down to Houston, and then they have to bring someone up from Houston to testify. And this is a big burden. Whereas if we have a lab locally that can do this,
sure,
this alleviates huge problems, a big hurdle.
So, but that is a legal, that is for legal prosecution.
We'd still be interested in legal. We think really that if we could, what the legal department was saying at that time was that they could prosecute one or two cases. That would be enough,
right,
to probably stop it, because these guys do not want to get involved.
Right, and that's testing the substance, that's testing this incense material or bath salts material. That's a much easier burden than the CLIA burden. Clearly, any of the folks that are here with the Department of Health understand that ending up with a CLIA test analysis can be done, but it takes time and it would take a significant investment to get that.
Well, if you could get a cost analysis for us.
Sure.
I think that would be really helpful.
Okay, Dr. Epstein?
From the health perspective, I enjoyed your presentation, and this is very exciting material. From a health perspective, what we might need in the emergency room would be rapid availability. It's not important. It's since the person is already in the emergency room, there's no barrier to getting blood and urine specimens. And it might not be so important to get specifics. What would be important is that a drug of this class was on board, so that we could institute treatment. And for that, of course, you would need the CLIA approval. You'd also need some kind of rapid turnaround. I mean, ideal would be a rapid turnaround, say at least 2 hours or less. If you have a longer test, then, it can be used by the person later on, but the utility will be much less. Do you have anything in the pipeline that might have a 2-hour turnaround for emergency room use?
Me personally, after spending 6 years with a 24/7, 365 telephone, I am loath to become an ER type person.
Right.
Personally. But we can develop, doing this test, doing a urinalysis, especially urinalysis testing, is relatively straightforward. Depending on what the drive distance is to come out to tie, we do have a lab that's open 24/7. We could certainly, in my world now, that's what God made graduate students for. So, hi, it's 3 in the morning, and here's your phone, and you have to carry the little beeper, and you have to go grab this sample or catch delivery of the sample and run it. I think, and again, being in the smallest large city in Texas, I think that we are allowed to have certain things like that, which are possible. The actual analysis of this from the sample through the instrument is probably an hour, maybe 2 hours most. It's not, to do a urine sample doesn't take a lot. To do that under the clear requirements with a standard curve, and you want to know, in your question, you're doing a tox test. That's a whole different level than saying, what level do we have where we can prosecute? So if you, bear with me a second, if you take a urinalysis for a drug screen, for marijuana, for instance, it has a level involved with it. There's lots of sensitivity below that level. That we know that there's drug there, but you're not going to take somebody's job based on the fact that they might have walked through a concert and they got a little exposure. You need to be here. In your case, in the ER, you're trying to answer that question, is this person being affected by this type of substance? Yes or no? And from a toxicological screen, there may even be much more rapid ways to deal with that at the hospital. I'm not a pro in that area, but I do good homework.
Thank you.
Other questions?
Well, along that line, and I'm glad you brought that point, but when we do urine tests in the ER, synthetic, natural, we do test for it and we get the results within. So our labs are equipped to do that, am I not right?
I'm not familiar where hospitals, I don't know.
For example, come and somebody comes with drug overdose, we routinely do urine tests.
Right. And I know that there are, I don't know what's on their specific call down screen of what they look for.
Including
and there is a cannabinoid, so it may well be there.
Does this show up on the routine cannabinoid screen?
Again, not being a clinical chemist in drug detection, in Texas, the world is divided very strangely. So if you want to do drug detection things, that typically goes through the Department of Public Safety. They are the ones that have the expertise in this. That's where I went to the tox talk, was in Austin at the DPS Central Laboratory. So they do, when I hosted the talk from Dr. Moran from Arkansas, the 2 chemists that came from the DPS here in Lubbock showed up at the talk. So they're aware of some of this, and I can certainly work more closely with them. If that's, as Dr. Reed said, let's develop some costing, let's see what's available and see who has it. They may well have a 24/7 type of an analysis here in town at the lab as well.
Okay. Any other questions?
Thank you.
All right. Thank you very much.
Thank you all for the
Very
invitation.
informative. We'll look forward to getting back and telling us issues of money. All right. Update on oil and gas subcommittee. We have Dr. Epstein to present on that. She's got a program up there, so I'll call her to the front of the room.
How do I advance?
Here comes Tracy.
Before I talk about what happened at the last Oil and Gas Citizen Advisory Committee, I wanted to make the Board of Health aware of some important new data that was just published in last month. This is an advanced publication date for this peer-reviewed study. This is the largest public health study that I am aware of. And I've passed out a summary for you, which gives the highlights in a slightly different order. Basically, let me explain. This was a demographic study, and the question that the researchers asked was, does living close to oil and gas wells, especially if there are a lot of them nearby, does that increase birth defects? And the researchers had some background suggesting that this might be the case. We know that birth defects have been linked to air pollution, specifically items like benzene, toluene, and hydrocarbons, which have been found in elevated levels in areas of oil and gas development. And so that was the reason that the researchers chose to invest in this type of study. And for some background information, this study was done by researchers at the Colorado School of Public Health, along with statistical help from researchers at Brown University. This was funded by the Colorado Department of Public Health. There was no conflict of interest that these researchers had. Regarding Colorado, there's some very dense oil and gas development in Colorado. The Colorado State Organization estimates that of more than 47,000 oil and gas wells in Colorado, over 26% are located in close proximity to a residence. As you will recall, one of the unusual aspects of unconventional oil and gas development in recent years is the fact that what used to be a predominantly rural enterprise, oil and gas wells out in the country, has moved into cities. And this is a case of heavy urbanization in Colorado. Remember that our current oil setback ordinance, our current ordinance requires setback of 300 feet between an oil and gas well and a residence. So we're well within this 150 to 1,000 feet. So the researchers gathered a huge amount of demographic data from 1996 to 2009. They looked at all birth records in rural Colorado. They chose rural rather than urban Colorado areas so as to avoid confounding air pollution issues with pollution from cities, such as industry and cars. They obtained all the birth records in these areas in rural Colorado, as well as all hospital and clinical records of birth defects and records and location of all wells, of years that all the wells were built, attempting to get a complete picture of both births and development of oil and gas wells in rural Colorado. And these are getting to be large numbers. 124,000 births were recorded. And with the demographics, of course, comes information about the age of the mother, location, residence, and other factors that they later used. This was not an air pollution study. Nobody measured anything. This is a demographic study. And what the researchers did is they analyzed, they took the data for all these wells and all the births and correlated them using some fancy statistics. And they analyzed the level of exposure of the mothers to these gas wells. And they had three groups, as you can see. The reference group was no gas wells within 10 miles, and this represented 66,000 of the births. In the exposure groups, they divided them into terciles, in 1/3 groups. The low exposure group was 1 to 3 wells within a mile, and that was 19,000 births. Medium exposure group, 4 to 125 wells per mile. And in the high exposure group, 126 to as high as 1,400 wells per mile. These are wells that were in existence at the time of the birth. Remember that. And here was the study. The researchers analyzed a number of congenital heart diseases. Not all the results were significant. I'm showing you the ones that were statistically significant. For congenital heart disease, which is the most common of the birth defects, compared to the reference group, which was 0 wells within 10 miles, there was a 10% increase in risk for people in the low exposure group. That's 1 to 3 wells per mile. For you number crunchers, that is 281 births. This is enough. These are large enough numbers to do some statistics with. For the medium exposure group, 4 to 124 wells within a mile, it was a 20% increase in risk. That is, increase in the number of babies born with congenital heart disease per records. And for people in the greatest density area, there was a 30% increase in risk. If your sheets contain the numbers, you'll notice there are approximately 19,000 people per group. You can eyeball it as it moves up from 281 to 300 to 355 births. These numbers were highly statistically significant. Again, for you math and statistic people, p less than 0.001. What that means is the statistical probability that these results were due to chance alone. And the statistics on this is less than, I believe, 1 in 10,000. And these were adjusted for numbers of confounding factors. We know that a number of, remember the speculation, the reason this study was done was on the belief that it was probably the air pollution that is the responsible factor. And so a number of factors were adjusted for to make sure, to try to adjust for other things besides oil wells. For example, whether the mother smoked. We know that smokers have benzene in their bloodstream and increase the chance of birth defects. And there were a number of other factors, including elevation. The height of the plane above, the height affects air, affects air pollution. And a number of other demographic factors that were available from these birth certificates. And the adjustments, after adjustments, the statistical significance continued, and these numbers were borne out. A second important but less statistically robust result was the number of babies born with neural tube defects. These are the anencephaly and the spina bifida. It is to prevent these diseases that pregnant women are advised to take folic acid. Folic acid prevents this. And in fact, the researchers found that neural tube defects dropped after everybody was advised to take folic acid, as we would suspect. The reference group, no wells within 10 miles, those were 27 births. Odds ratio, statistically, this was set at 1 because this is the control group. And the incidence, the number of people, of babies born with neural tube defects, was increased only in the group of highest exposure, 19 births. That gives you an odd ratio of 2, in other words, double the risk. However, as you can see, the numbers are smaller. And it was statistically significant. However, the numbers were smaller and too small to perform multiple risk adjustments for factors that might affect air pollution. And here is the conclusion of the researchers, which seems appropriate and responsible to me. In this large cohort, we observed an association between density and proximity of natural gas wells within a 10-mile radius of maternal residence and the prevalence of congenital heart disease and possibly neural tube defects. So this is currently the largest public health study we yet have, and is adding significantly to the growing body of evidence that proximity to natural gas wells represents a threat to public health. I have the original paper. Once again, it was just published in advance on January 28th, and I've got several copies. I'm willing to give people copies, and you have a summary in front of you. There are some extra copies if anyone has it. Does anyone have questions?
Dr. Reed.
I think it's a very well thought out, interesting, fascinating study. Can I ask you one other question along with that? When are you supposed to report to the city council about the oil and gas subcommittee? When are they supposed to report to city council? Their final...
The oil and, I don't know the exact format. The oil and gas subcommittee has a series of meetings.
Right.
And the chair has told us that he will, I believe the chair's plan is to report at the end of the proceedings. I don't know if he's reporting.
But you don't know how
what's
long?
current. I think he wants reported to the city council. Steve is also on the oil and gas committee. Do you know exactly whether City Council is receiving monthly updates on this?
I don't believe they are. I think that's why the staff is there. But
Update City Council.
along those lines, from our last meeting, it sounded like one more meeting and then the final report.
One more meeting, so that would be 2 months from now, roughly, or
1 month.
a month and a half?
1 month.
1 month?
Right.
Well, the reason I ask is because of data like this and other data. I think that there should be, I'd like to propose, there should be a separate report from the Board of Health about the other side of this. There's another factor here that, I don't know, is the Oil and Gas Committee, do they have a sort of a health part that they're going to present too?
At the last committee meeting, I mean, I might as well give my short report. At the last Oil and Gas Committee meeting, there was a proposal for setbacks to establish setbacks of 1,200 feet from a habitable structure to the well. As you know, currently the setback in the ordinance is 300 feet, and that proposal was defeated.
Okay. So there's only a month between now and.
So,
could we have a subcommittee meet and talk about just the health aspects of this, and then report back to the next meeting for possible approval by the health Board of Health for presentation to the City Council at the same time they have the update from the Oil and Gas Committee report?
What do you think, Ann?
that would be good. I mean, it's, if City Council would like to hear more data, I think this is an important, I think this piece of data is an important addition to City Council's, should be an important addition. I know City Council is charged with protecting the health and welfare of the citizens of Lubbock. I think this is very important.
Steve?
Along those lines, Zach Brady, who's the chair of the committee, did point out and made a point that everybody was aware that in the report from that committee, all minority opinion will be included with the report from that committee.
Well, I just thought it might be helpful to have a separate report from the Board of Health.
I would certainly be happy to give City Council as much information as they would like to.
Well, and I think that when they present to the council, since we had previously presented our recommendations, I think it would certainly make sense that we would want to be present to answer questions that council might have, since it sounds like the two reports may have some differences, and just to bring back sort of counterpoint, because they're the ones that are going to have to make the call.
In the years since we presented our request to City Council, our proposal to City Council, there has been a steady flow of new information with important data coming out every few months. And this was, as you can see about the publication date, there's this 28th of January. This is online advanced publication. I don't think it's even been published in print yet. The copy that you see is in manuscript form. So I think it would be very important to update City Council about the scientific, about the stronger and stronger scientific basis for significant public health concerns.
Scott, do you have a comment?
Yes, sir. I just wanted to say, is this something that you want to do prior to the presentation from the committee, the Oil and Gas Subcommittee, or is it something you want to do at the same time? Because we would have to schedule that.
Both,
of course. It has to be put on the agenda if you want to have the ability to have dialogue.
So, in one sense, what I'd like is for us to put together something next month, if that's enough time.
Stephen, I guess, do you know when the report is due, or are you thinking?
I think the report's been delayed, pushed back already.
Okay.
And didn't that sense you got?
Zach has told us, that is Mr. Brady, the chair of the committee, has mentioned on several occasions that he wants to get this moved on, and one has a sense of haste.
Now, how hasty are we talking about?
Well, I don't know. He has said in the past that he would like to have this voted on by the next meeting.
And when should you do the next one more meeting and then the report?
I think that's his desire.
So when's your next meeting?
It hasn't been set.
It'll be
next month.
Middle of March.
Middle of March. And our next meeting is third Friday.
But then you have a report to generate after that meeting that would come out sometime later, I don't know.
So we would have time for our next meeting and then to report to City Council at the same time.
Well, why don't we, since y'all are active on that subcommittee, I mean, I think we've already done the majority of the legwork. We can add the additional new information, but if we could be dependent on the two of y'all, that if something's sticking its head up and we need to take an action, then we can either circulate, have a subcommittee meeting here, or just ask we could call a special meeting if we needed to. But, I think that what we're going to put together, there's not a lot of, I mean, you guys have already done so much of the work. I think that we could pretty readily get it together. We just don't want to miss the timeline. So if we could rely on the two of y'all to just advise us, hey, because I think a lot of it's going to be give us enough time to generate some sort of organized response that can be presented to council at the same time as the other report. But it doesn't necessarily have to convene a whole Board of Health meeting as it is among the people that have been representing us.
Well, you would also, Mr. Chairman, you would have to have an action item to approve
Oh, okay.
whatever report
Yeah,
comes out of your committee as a recommendation to the council.
And as a Board of Health member, not as an oil and gas committee member,
Right.
I would suggest that if you want to put together a report based on health data, and that's what I assume you're talking about primarily,
right.
I would start doing it.
Yeah.
Because it's better to be proactive than
Right.
reactive.
But that's something that, would you be willing to take that task on and draft the initial report
Yes, I would.
so that we at least have it pretty much put together?
That's what I'm saying, just don't wait.
Yeah.
until-
Right.
Okay, so
We need to move.
if we can empower you to begin that report, and then we can look at it at the next meeting, so we'll include that as an action item. Or if sooner need be, just alert us so that we can take what action we need to.
Can I add something to that?
Sure.
This is one aspect of health. I'm concerned about water and water quality. I assume that will be part of this because water is getting to be the biggest problem in West Texas or these parts of the world. And California's got massive problems, New Mexico's got huge problems, and I'm sure West Texas is going to follow along. And when I saw the presentation from our water commission or whatever it is here in Lubbock, that was devastating to me. That we don't have much water. I mean, they presented this thing that we have 100 years, and the numbers didn't add up to 100 years. They added up to 15 to 20 years. And if we start screwing around, and now there's reports out about arsenic coming up into the water from this fracking. If we have arsenic, we know we have arsenic down there. If that starts coming up, we're going to have. This is for the future of this town, and I think that has to be also included in this because I think this is a place where I'm going to live, and my kids are going to live, and my grandkids are going to live. In the future, we have to have water, and I'm really worried that. I think we should be talking about pipelines to bring in water to Lubbock rather than pipelines to bring oil down here. But I think this is a consideration that the city has to think about. And
There's a lot of related to that, and I'm just speaking as a Board of Health member. There has been a lot of interesting information to